So, here we are. The year is 2022. I'm so delighted that Julie invited me again to speak and to have this conference again at 2022. It's, 60 years ago, I landed in this city from Alexandria, Egypt, thinking that I was finished with developing countries. But I found developing countries right in our own backyard here. But I'm also delighted that you have accepted my virtual presence here. You think I'm here, but I'm not really here. I'm a hologram because I'm speaking to you from Ghana, where we are celebrating the amazing outcome of all the work that we have done together. Through this hologram, it's hard to tell that I am 10,000 miles away, but believe you me, I am not here. So I'm really thrilled to be able to share with you three things here. I want to share with you what we talked about in 2012, because Julie asked me to sort of summarize what went through and what we talked about in 2012. But I also then want to share with you where we are at 2022. But more importantly, I want to tell you how we got there. So, taking us back 10 years. Urbanization, we talked about urbanization. We said it was increasing global phenomena with negative as well as positive effect. In 2012, it was confirmed that more than half of the world population, approximately 3.5 billion people, lived in cities. As urbanization increased, the number of urban poor continued to increase. In fact, Inga Bjork-Kloby, who was in the United Nations, said of the many risks to health that are linked to rapid urbanization, none is more compelling than urban poverty. 32% of the world's urban population lived in slums. 70 to 80% of these were women. There, 3/5 of the world, 1 billion poorest people were women and girls. Many of these poor women were moving from rural to urban areas or moving from other countries to urban areas in the United States or urban areas in other parts of the world because they were looking for opportunities. The 2012 conference symposium, the speakers did a fantastic job in painting the picture of how women have been uniquely burdened by being in urban areas. The process of urbanization contributed to scarcity of resources, lack of infrastructure, deprivation of social structure. In LA County, over half of the women reported they were living in poverty. Limited education, exclusion from jobs, training programs, because they are new arrivals here, contributed to these devastating statistics. Women who lived in concentrated poverty neighborhoods in LA, South LA, and portion of San Fernando Valley, Boyle Heights, experienced 34% greater maternal health risk than the city as a whole. And women in poverty faced more violence, less access to health care, suffered more from premature death, disease, disabilities than women who are more advantaged. In fact, an estimated something like 700,000 or 21% of women of the ages of 18 to 64 were uninsured in LA County. They fell in the medical poverty trap. They have to pay for their own health care, and they incurred debt, and it made them even more poor. Across the globe, lack of access to skilled birth attendant led to disparities in maternal death rates and obstetric fistula rates between the poor, the difference between the poor and the wealthy. For example, in Kenya, Mali, Rwanda, and Uganda, 80% of the women delivered without a birth attendant, a skilled birth attendant. 80%, that's in 2012. Also, women and girls were more vulnerable to sexually transmitted diseases, and I think there are some of the panelists talked about that. Women who lived in urban centers were 1.5 times at a higher risk of contracting HIV/AIDS than their male counterparts. And they were twice at risk compared to their rural counterparts. In sub-Saharan Africa, 75% of infected adolescents were girls between 15 and 24. I think transportation was talked about, waiting was talked about. Immigrant and migrant women lived at the periphery of the city. They couldn't find transportation to go for their health care, and because it took so long and the waiting was so long, they lost wages or they were fired from their jobs. Transportation centers were not well lit, and women and girls frequently were subject to more violence while using public transportation. There were also the traffic accidents and the traffic injuries, which are a major cause of death for women. Globally, road traffic accidents was one of the top 10 causes of death among adult women ages 20 to 59. In some countries like Thailand and India, where they are supposed to be wearing helmets when they are on motorcycles, you will find the men in the front wearing helmets, and the women they are carrying in the back of them are with them no helmets. In 2012, the panelists described how violence against women ages 15 to 44 caused more death and injuries, more than cancer, malaria, more than traffic accidents, and more than war. We also learned about human trafficking, a practice that was equivalent to modern-day slavery, and indeed it was the epidemic of that decade. And it was something that our consciousness was just being raised about. Where did they come from, the trafficking? From developing countries, where poverty was rampant. But we also learned that trafficking happened in every state in the United States, 50 states plus DC, and even in some of the US territories. We learned there is a clear link between homelessness and history of domestic violence. Sanitation was an issue, a major issue. It was estimated that less than half the population in urban centers in Africa, Asia, and Latin America, less than half had water piped into their homes, and less than 1/3 had adequate sanitation. Water is very much linked to women and girls, because when we don't have water, women and girls are bringing water, carrying water, takes away from their education and takes away from their being economically able to be economically savvy or gain economics. But there was also the lack of readily available public toilets, and that frustrated young women with menstruation. But older women stopped drinking water because they didn't know where to go for toilets, and then they came into our emergency rooms with dehydration. Women are attached to food and water very much. In the United States, low-income areas had 30% more corner stores than middle-income areas, which lacked healthy food, and we learned about that. Low-income women reported the highest consumption of fast food and soda drinks, and the lowest level of physical activity. In LA County, 43% of women 18 to 39 years of age ate fast food at least once a week, or even more than that. The lack of safe public spaces to exercise, combined with limited access to healthy food, increased, guess what? We talked about obesity, malnutrition, hypertension, heart diseases. But equally troubling were the number of burn injuries because of stoves and electric gadgets illegally and unsafely connected in the poor areas. But there were some hopeful signs in 2012. There were lots of hopeful signs. The US Secretary General Ban Ki-moon recognized the importance of women's health, and he came up with a global strategy to improve the health of women and children around the world. A major statement. Under his leadership, United UN Women was formed, and Michelle Bachelet, who was the former president of Chile, came to head that office and developed an incredible 5 priorities, among them gender equality priorities for all countries and empowerment of women and sectorial planning, intersectorial planning. Also, around that same time, in 2010, 2011, the group of 8 major countries, Canada, France, Germany, Italy, Japan, they made a commitment to maternal and child health, and they made a commitment to family planning and contraceptions, and they made a commitment for prenatal and postpartum, and they put their money where their mouth is. And one other exciting thing that happened around the time that was very hopeful for us, 3 women received the Nobel Peace Prize for their nonviolent struggles for the safety of women and women's rights, and because they fully participated and led peace-building work. Ellen Johnson Sirleaf, Africa's first democratically elected female president of Liberia. Lima Gaboy, head of the Women, Peace and Security Network, and Taukul Carmen, a 32-year-old woman in Yemen who led women journalists. She was called Mother of the Revolution in Yemen. And in October 2012, we also celebrated the first time United Nations declared the first International Day of the Girl Child. It was the first time the girl child word was used publicly, although we had known about it for a long time. Worldwide, these are some of the things that made us hopeful. But here in California, Governor Edmund Brown Jr. signed a bill in 2012 that made it easier for women to obtain birth control. It also allowed nurses, a novelty, to dispense and administer the hormonal contraceptives under a standardized procedure, using nurses up to their full capacity. Senator Barbara Boxer was a leading defender of women's rights to choose and worked to pass the Violence Against Women Law and Women, Peace and Security Act. Dr. Jonathan Fielding, who was the first speaker that day in 2012, the Director of Public Health, addressed and talked about the centrality of women in making changes in the health of communities. Also, the Commission on the Status of Women and Girls was created in California to develop recommendations related to gender equity. Gender divide was still loud and clear and was present. Nationally, President Obama and Secretary Hillary Clinton made girls and women central in U.S. global health programs, and in fact, they went further and appointed Milan Verveer as U.S. Ambassador at Large for global women's issues, keeping women's issues at the forefront. And to make efforts to end human trafficking, the U.S. State Department released Trafficking in Persons, a comprehensive account of the efforts of governments worldwide to combat human trafficking. Coalitions were formed, people were really energized to abolish trafficking, all the way from Thailand to Estonia. California Endowment provided support to the members of California communities, ensuring affordable housing, good jobs, safe spaces, and health food. Also, USAID implemented a women and girls-centered approach and didn't give support to the countries unless they made women and girls the center of their work. An organization, CARE, and I was a member of the board at the time, it made women the center also of their programs in 60 countries. And the International Council of Nurses established the Girl Child Initiative, taking care, supporting girls of nurses who have been lost because of HIV/AIDS to support their education. Lots of advocacy groups were established. President Amy Gutmann, then the president at the University of Pennsylvania, hosted, in partnership with the United Nations, brought together 25 presidents of universities, and they developed a white paper and a set of policies related to how to empower women in their institutions. And at the University of Pennsylvania School of Nursing, it was established the Center for Global Women's Health in 2011, and that is to work on the future future of women globally. Dr. Lynn Summers was appointed the chair of that. And now it is 2022. And now it is 2022. Women today have equal opportunity to jobs in the formal sector, and more training programs have been created for women. Efforts to substantially improve maternal and child health have paid off due to an increase in the number of midwives and the skilled attendants. Countries across the world adopted programs modeled after BRAC in Bangladesh that has community-centered approach to providing evidence-based care for maternal health and child health. And because of all these things, we have 250,000 fewer women dying in pregnancy and childbirth, and nearly 3 million fewer babies dying in their first year of life. Countries around the world made the bold commitment to address the policy, financing, and delivery barriers to women accessing contraceptive information. It became more accessible, services and supplies. As a result, 200 million women have received access to contraceptives, and more than 110 million fewer unintended pregnancies occurred. And we learned from Thailand to give incentives to women to use contraceptives. Women today are able to access health care and to get work via affordable and accessible transportation. We learned from different parts of the world. In Medellin, Colombia, for example, it was the first city to design a gondola system called metro cables linked to the city's metro mass transit system, and made it accessible for the poor people in the periphery to access health care. We became more creative in providing safer transportation. We learned from India a strategy to protect women. In New Delhi, bus drivers have been trained to stop the bus until the perpetrators get off and take detours to drop off the perpetrators that are harassing women, that are preventing them from riding the public transportation. To promote good use of spaces, women in Nairobi, Kenya, adopted a creative initiative called Adopt a Light. Adopt a Light. Businesses adopted a light and kept the light on with the idea that they would also advertise. Today, more cities provide safe, open spaces for women and girls for active sports, for walking, and we saw that in Lima, Peru, in Quito, Ecuador. There are exercise space everywhere, and that has taken care and decreased obesity, hypertension, and heart diseases. Women participation increased substantially in political urban planning. It was 4% of women in the political arena in 2012. Now it's 25%. Even a mandate that all schools should have separate bathrooms for girls and boys increased girls with menstruation going to school. There is more access to healthy food because this was instituted and legislated. There are small kitchen gardens in different places. And all these achievements have empowered women with the basic tool to break the cycle of poverty, to increase their health. So the question is, what did it take? What did it take to continue the momentum that started in 2012? What did it take to create safe and healthy environments? What did it take to eliminate disparities? What did it take to ensure that women were able to reach their full potential and the healthcare workers who are well prepared can also work up to their full capacity? It took three actions. Thought leadership, partnership, and paradigm shifts. It took thought leadership to develop the evidence and train the next generation of leaders. It took knowledge development. Universities around the world played a crucial role in developing and disseminating knowledge. It took university commitments from UCLA, Penn, to integrate knowledge about the determinants of health for women within a more holistic and environmental context, and to train the next generation to understand the importance of the physical environment and the social environment. This supported thought leaders to come together to talk about and to bring the evidence against cervical cancer, breast cancer, infection, obesity, hypertension within the context of social structural burdens of lack of walkability, connectivity, lack of safety, and lack of integration. Knowledge was used to educate people, but knowledge had to be developed. The new generation became the voice because they learned that. They got the evidence and they learned how to be the voice for healthcare within communities that are healthy communities. But it also took the power of partnership. It took partnership and collaboration between the different sectors. And it took the work of everybody involved, but it also took the third thing, paradigm shift. Paradigm shift from thinking about women in terms of their uterus and in terms of their ovaries to women as productive beings rather than only reproductive beings. It took a paradigm shift to a feminist, a post-colonialist feminist perspective, a humanist perspective, a social justice perspective that we have adopted. It took a paradigm shift to know that we are not able to train physicians to become primary care providers because men and women are not going into primary care, and to accept that nurses as the advanced practice nurses could do that primary care. It took a paradigm shift from being protective of professions to working together interprofessionally. Today in 2022, we are closer to improving the quality of life for urban women, their families and communities, through the advocacy, the commitment, through the partnership, through a paradigm shift. And you, the many of you who were here in 2012 and continue to support this initiative since then, made that happen by supporting research, by supporting education, by supporting centers of learning, by supporting students of the future through endowments, through endowed chairs, through scholarship for students, through global fellowship, through having a voice. So I'm here to thank you. I'm here to thank you for having made a difference. It took your advocacy, it took your engagement to really bring us to where we are today. It took your educating your communities and raising awareness about cultural and social determinants that affect women's health and how it affects their safety, human trafficking, housing, education, access to healthy food and health care. It took your moral enragement about injustices, about lack of women's voices and perspectives and policies to correct gender inequities. And you were morally enraged after you heard all the panelists. However, it is 2022. Our work is still not finished. We still need to continue to be ambassadors, spokesperson for the advancement of women's optimum health and well-being, and linking it with the community, and linking it with designing urban areas. Thank you, each and every one of you, for having been here 2012, for having been morally enraged, and for putting your weight behind it and your voices behind it. And now I leave you and get back to celebrating in Ghana.